licensed practical nurse. Hi guys, welcome back to my channel. It's your girl Benedicta. So today I want to talk about different kinds of Ausbildung we have, and I also want to nursing Ausbildung, and I also want to compare it to the nursing in US, because some people are getting confused of it, that it's not the same, it is the same, it is this, it is that. So I went and make my inquiry, and I have a friend in America. We went to the same university. She traveled to America to stay with her husband, while I traveled to Germany to live with my own husband too. So, but she studied nursing again when she got to America, because it's English speaking. So she had the opportunity to study nursing early immediately she got to America. So I have to learn language for so many years before I could study nursing. So I have asked her a lot of questions, which I now compare the question with what we have here. So, for instance, I will start from the lowest, which is in US, they call it CNA. CNA, that's Certified Nurse Assistant. So, CNA is equals to here Pflegekraft, sorry. CNA is equals to Pflegekraft. So, it's Pflegekraft, that is CNA. So after CNA, they have LPN. LPN, which is licensed is equals to here as Pfleger assistants. That is the Pfleger assistants in Germany. What they does, LPN, they work in hospital, they work in home care, which is Elternheim here, they work in Lebenshelfer, which is where they help disables, where they are living. It's like Elternheim to have worked there too. So the same thing, Pfleger assistants. As a Pfleger assistant, you can work in the hospital, you can work in Elternheim, you can work in Seniorenheim. Seniorenheim and Elternheim, they are the same. They just call different name how you like it. So they can work in Seniorenheim, they can work in Lebenshelfer, So that is Pfleger assistance. Then that is Pfleger assistant. Then RN is equals to pflegefachfrau, which is also Krankenschwester, is their RN, which is registered nurse. That is what we know as registered nurse in US. So it's the same thing with our pflegefachfrau, which is the 3 years Ausbildung. Why they are doing it 3 years or 4 years? You can do it as BSN, which is Bachelor in Nursing. Then you can still do it year 2 as Bachelor 2 in Nursing in the university, 4 years too. So you can do it 3 years, you can do it 4 years. It's the same certificate, but when you are working, you receive different salary, because you study 4 years as a bachelor is different from somebody that just did Ausbildung for 3 years. So these ones, they work also in hospital, they work in Elternheim, they work in Seniorenheim, they work in Lebenshelfer. You can work anywhere, but Pfleger assistants, which is LPN, they are always under Pflegefachkraft, which is RN. They are always under them. That's the answer to them. Not that they answer to them directly. There are things that Pfleger assistants that are their duty. For instance, maybe that Pfleger assistants that are working in the hospital, for instance, when old person or somebody that is very sick that is in the hospital need to be bathed, need to be fed, is the duty of Pfleger assistants to do it. But some Pflegefachkraft, which is the 3 years Ausbildung, they used to do it. So they used to do almost the same thing. They have a lot to do. So that's why in every organization like hospital, Like Elternheim, Seniorenheim, they always look for pfleger assistants. They are always looking for pfleger assistant because the Pflegefachkraft, Helfer, yeah, Pflegefachkraft cannot do all, especially like for instance, feeding someone takes time. You don't need to rush and feed the person because the person is sick. Some of them cannot even swallow. So it takes time for them to eat bit by bit. So Pfleger assistants have to sit there and feed. Or Pfleger F-craft, you know, without certificate is the Pfleger F-craft. So you have to sit there and learn. The only difference between Pfleger F-craft in Germany and Pfleger F-craft in US, Pfleger that is a CNA, they used to um, learn it, that study it for like I think 1 month or 3 weeks or so, you know, then they have a certificate, which they still have it here, which is a course for 3 months. I've said it before in my former video. It's a course for 3 months that you can do, you know. After this course for 3 months, but you'll still be working as Pfleger F-craft. It's only when you did the 1 year Ausbildung that you can work as Pfleger assistants. Your salary will be different. Or after 1 year, so many people don't know this. After 1 year as Pfleger assistants, as Pfleger F-craft, sorry. After 1 year as Pfleger F-craft, you can apply for Behandlung Pfleger, LG1 und 2. You can Google it. LG1 und 2. The requirement is 1 year, 1 year Tätigkeit. That's 1 year. You've worked for 1 year in the Pfleger region, in the Pfleger environment. 1 year. Full time, not part time. Full time 1 year. So when you've worked for 1 year, you can study. This course is always taking some 8 weeks to 12 weeks. It's not always long. Then after then, you go and do 3 months practical. Then your Krankenkasse is the one that is going to recognize to give you your Anerkennung. Then this certificate that you will now get is equals to Pfleger assistance certificate. It's just the same like you went to do the 1 year Ausbildung, which I find very, 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 very good because you'll be working, getting your salary, working at your convenience until you complete 1 year. Not the because Ausbildung in Germany, whether it's 1 year, whether it's 3 years, it is hard. It is hard. The practice that you have to be going, you do maybe 3 weeks in the school, then 6 weeks or 8 weeks in Krankenhaus. That Krankenhaus is full time. You have to go. You will work, you know. So if you're a mom and you cannot do that, you can still be working. After 1 year, you apply. You can do it online, you know. Apply for this and you start you apply for this, then you do the course. After the course, you go and do your 3 month practical, then you get your certificate. You are now a nurse with a certificate. Kranken assistance, Pfleger assistance is also a nurse. Is a nurse. You are the same thing with a nurse, just that your own is a little bit lower, but you're a nurse. In every organization, every work, they have higher level, lower level, whether it's nursing, whether it's in the bank, they have junior staff, they have senior staff, but they are all the same staff. For instance, if I had to work in the bank here, I will start as a junior staff. Then I have to start doing so many Weiterbildung. They have it in the bank, they have it in different places. Then I can be raising my career. So don't always look at it that Pfleger assistants, you're not a nurse. No. This my channel is to educate you. You are also a nurse. You will measure blood pressure. You will measure sugar. You will do inhalation. You are going to do so many things as Pfleger assistants. You remove Vigo from somebody that they put drip. You are going to remove the Vigo, you know. There are so many things you will do. There are so many things if you want to work in the hospital, even if you want to work in Elternheim. In Elternheim, if you have your certificate as Pfleger assistant, you can measure blood pressure. You can measure sugar. There are so many things you will do, you know. So it's all nursing together. So don't always look at it as, no, I don't want to, it has to be 3 years. 3 years hospital is the best, is good. But what about if you can't? 3 years is a long time. Instead of you to 3 years is a long time that I'm not doing, why not do the 1 year? I'm still advising on doing the 1 year Ausbildung. But if you can, you have somebody that will look after your kids, you are strong enough, you are healthy enough, you are intelligent enough, you can do it. Why not? That is the best. That is the best. The 3 years Ausbildung is the best, you know. And everywhere, even in US, so many people that did LPN, which is Pfleger assistance, they went on better later. I'm always mixing my Dutch. Later to do their RN. Like my friend, she started with LPN. After her LPN, she had 2 kids. Then later she went and do the other one, and the husband was not working, so she could do it. So that is how she did it. So yeah, I hope I'm able to differentiate the Ausbildung so that you know which and which is this. The US own is this. So when you are doing a particular Ausbildung, you know it is the same with the one that they are doing in the US. So I'll end my video here, and I will say thank you very much for listening. Please make good use of all the information I'm bringing to the table, and have a nice day. Bye.